I didn't want to just say, here's some antidepressants and call. I told you. Welcome back to my channel. If you haven't seen any of my videos before, my name is Natalie. I am a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. I also take a look at personal statements and resumes, so if that's something that you need done, please take a look at the description box down below, and there's a whole process telling you how that can be done. So first things first, I have my little puppy Bubbly on my lap, so if he pops in and out or makes little noises or something, that's just what it is. But for today's video, I really wanted to talk about the importance of getting to the root problem of whatever your patient's symptoms are, because it can be so easy to say you have X symptom, here's X medication, or here's X treatment, and sometimes, providers don't take the time to get to the root problem and treat the root problem so that you don't have to have X and Y medication or X and Y treatment to kind of mask the symptoms or to cover it up or to, kind of superficially treat the issue. So I wanted to give an example of one of my patients when I was in clinical. Of course, there's no patient identifiers or anything like that, but I really wanted to I wanted to give this example because I think it's important for us as providers, especially as NPs, because we're taught to, kind of look at a patient holistically and see what we can do to help them, not just at the superficial level of, oh, here's medication, just throwing it at you. You want to see what the root problem is and see if there's any other way we can help that individual so that, we're taking care of the actual issue that's not trickling along other complications. So for the example that I had, I was in clinical, my primary care rotation, and we had a patient, and she was a younger girl, and she was there for a weight loss program. And so we talked a little bit. We wanted to see, what she wanted to do, like what was her goal and all of that stuff. And she was telling me that she was very, very depressed. And so I said, okay. So we talked about that more because that's definitely a huge issue. We want to make sure that that is taken care of as well. So we talked about pretty much everything. I asked her about school, asked her about family, asked her about any jobs that she has. I wanted to make sure that I hit all the different types of depressive triggers that could possibly occur, because I didn't want to just say, she was younger, I didn't want to just say, here's some antidepressants and call. I told you. And here, let me put you down. Here, let's go down. Let's go down, okay? I didn't want to just just prescribe her antidepressants because I wanted to see what the root problem of her depressive symptoms were. And so we talked about everything, like I said, family, we talked about school, we talked about any type of life stressor that could occur, and what we figured out was that her life stressor was that she had gained weight, and she was there because she wanted to do the weight loss program. So I thought that was very important. And it's a very, very simple example, but it's something to show that she is indirectly taking care of her root cause of her depressive symptoms. Some other people might have just said, oh, you're depressed, let's try some antidepressants and call it a day. But I think it's important to figure out what is the root cause of her depressive symptoms, because if she's taking care of the root problem, it's possible that she may not have those depressive symptoms. And if she does, then we'll go from there. But I think it's important to try different steps along the way before just saying, here you go, here's some medication, especially because she was younger. So what I said was, I spoke to my preceptor and I said, hey, she's having these depressive symptoms. However, we found out the root cause of her depressive symptoms were because she had gained weight and she really wanted to lose weight, and she was, uncomfortable with her body and stuff like that. So but that's what she's here for, to treat that. So I was telling my preceptor, let's do this weight loss program for like a month or two, come back, see how she feels, and then if she feels like that she's still depressed or maybe doesn't know how to cope with different things, that we can either try medication and or try going to see like a therapist or psychologist or something like that, to have like a dual treatment plan. So my preceptor agreed, so that's what we did, and she came back I think in a couple of months and she felt a lot better. She did still have some depressive symptoms, but she didn't feel as I guess, depressed as she did before, because she saw that she was losing weight and that she was getting to the goal that she wanted to be. She felt a lot more comfortable. She was a lot more confident the second time that I saw her. So it was a really, really great thing, but I'm so glad that I didn't just say, here's some antidepressants and call it a day, because she started to feel better because she was taking the initiative to get her health on track and to feel better, and she did that for herself. You know what I mean? And if she had come back and still had depressive symptoms, of course we would discuss different medications and different treatments and stuff like that. But I don't think that that's something that you should just automatically do. And I saw a great result for her not doing anything and just let her focus on the root problem of her depressive symptoms. Now, to say that can apply to different scenarios, we want to see what the root cause is. So I guess let's say for a headache, we do these things called headache diaries or migraine diaries. So basically, if you have a migraine or you have a headache, you want to write down what happened before that. Were you outside? Were you eating a certain type of food? Were you doing a certain type of activity before that headache occurred? And sometimes you can just, have simpler medication, or you can try avoiding those triggers. So things like that, I think, is important for us to, as providers, to ask our patients, because I think it's a little bit kind of sucky, I guess, if you just say, oh, well, you have a migraine, here's some medication, or here you have this, here's medication, or here's a treatment, or whatever. What is the root problem of why that patient is having X or Y symptom? So if it's in the case where they're having headaches because they're just eating a certain type of food, like sometimes chocolate or wine might cause a headache, then we might want to say, let's reduce those triggers and see if you still have those headaches or not, and kind of go from there. I think it's very important to have like a step-by-step plan of what you plan to do for that visit, and if that doesn't work, what you would do further. And it kind of helps the patient feel a little bit better, like, oh, okay, even if this doesn't work, there's a plan to continue on. It's not like, if this doesn't work, I don't know what to do. But I think it's very important, again, figure out what the root problem is, see if there's any triggers or if there's anything that you can kind of avoid so that there's no symptoms, afterward. So I hope that kind of makes sense. I hope that example was pretty, straightforward and pretty simple, but it's definitely important to understand that it might take a little bit more time, may take a little bit more critical thinking and asking more questions and kind of digging into the root of what's going on. But to me, I think it's very, very important. And then, of course, if that doesn't work, you go on from there. And sometimes people do need medications, sometimes people do need treatment, but then sometimes people don't. And I think it's important to make sure that you look at every avenue before setting your plan, because not everybody's a textbook case. A lot of the times it's not, and you want to make sure that you do any type of plan or treatment that's specified for each particular patient, because remember, you're treating the patient, not the disease. And everyone that has different conditions are manifested differently in each person. So it's very important to make sure that you're doing the best for that particular patient. So yeah, thank you guys so much for watching. I hope that I explained what I wanted to say very well. If you guys have any questions, please feel free to leave a comment down below, or you can go ahead and email me. I hope you guys have a wonderful morning, afternoon, night, whatever it may be. And remember to always, always believe in yourself. All right, you guys have a great one. Bye.